Good afternoon. It's a pleasure to be here. My name is Micheline Coelho. I'm a speech and language pathologist, and I will present our experience in our center, titled Multidisciplinary Treatment of Cleft Lip and Palate, Experience of the imip Center for Treatment of Craniofacial Anomalies in Recife, Northeast region of Brazil. Cleft lip and palate are one of the most frequent congenital anomalies among oral cleft in the human population and occur to the no fusion of the facial process between the 4th to and 12 week of entering life and may be associated with or not syndrome. When we get pregnant, we idealize our child, our imaginary baby, and suddenly we find ourselves that the real baby with a congenital malformation. According to the Ministry of Health, the arrival of baby with a congenital malformation, procedural discontinuity relates to the idealization of the perfect baby, with shattered dreams and negative feelings, not only of the couple, but also of the family. The worldwide prevalence reached approximately 1 case of every 6 months, which represents the birth of a child with cleft lip and palate every 2.5 minutes in the world. Its incidence vary according to the geographic area, race, and ethnicity, and socioeconomic status. In general, Asia population has a high incidence, about 1,500 or more, while these incidents in the African population decrease 1 to 2,500 neighbors. In Brazil, Rodrigues in 2009 found the prevalence at 0.43 per 100 live births based in a system unique health and hospital information system. The information system of live births in Brazil called SINASC and the Brazilian Atlas of Human Development. Webby estimated the children with oral cleft between 2,900 and 400 neighbors in 2011. CADEF is a reference center in the northeast of the treatment of cleft lip and palate of craniofacial anomalies, accredited by the Ministry of Health to perform high complexity procedures since 2002. Currently, there are 1,571 patients with cleft lip and palate and other craniofacial anomalies registered at CADEF. The multidisciplinary and interdisciplinary treatment directed that these patients start with prenatal diagnosis and family counseling, attending the care and feeling at the baby, treatment protocols related to primary surgery of lip, caloplasty, and palatoplasty, and recommended for 3 and between 9 and 12 months of age, respectively. In the diagnosis team composed the plastic surgery, orthodontics, speech therapists, geneticists, and psychologists. We attend to the patients together and plan the individual treatment of for each patient. The chronology of treatment for each one involved surgeries and treatments in other specialties, oral and craniofacial surgery. The nursing is the first person that assists the patients, perform the inspection of the skin and the body, health and health, auscultates of the check if there are any respiratory changes or not, request preoperative laboratory tests, and when necessary, and supplement ferrous sulfate, because you need to care the patients, the babies. The nursing, the guidelines, the nurse is our routine, feeding routines, instrument that the babies use to feeding, special formulas like a VRL, probes, or gastrostomy. The risks of the respiratory risks, the nurse evaluate physiological assessment, guidelines with positions because it's changes about the Pierre-Robin sequences and or basic problems. Factor risks about the respiratory disorders, specifically Pierre-Robin sequence. Our protocol, the protocol word, we made a polysonography with the babies. When the baby has a poor evaluate the O2, it's necessary evaluate the plastic surgery to osteogenic distraction. The importance of the first dental visit is the first time that the patients pass, all the family pass. The first visit engage with family engagement, oriented the direct counseling, oriented the high hygiene buccal, and accompany the facial growth. And the objective, the guidelines, is spoon bottle, food introductions, cleaning the oral cavity, and brushing. We have a dentistry laboratory, and we have a play with the children, with the family, learn health, the oral health. When the breastfeeding it's possible in the cleft lip and palate, the cleft palate is possible, breastfeeding and no impossible. But when we have a cleft lip and palate or cleft palate, it's very difficult to breastfeeding exclusively. Then we oriented some positions, upright position, laid back breastfeeding, or clutter hair breastfeeding. Or when it's impossible, we use a cup, the baby. We learn the family, the mom, the mother, give the feeding. Then it's very important. The position is 45-degree. Or use the bottle. Then all the babies uses evaluate this possibility, the oral feeding. Then you use this instrument. Or when it is possible, we introduce some foods and we try to. The speech language therapist uses at the same time. And introduce the solid, then it's very important the developing the children. The caloplasty, it's very important. Aesthetic surgery, but not only aesthetic. The breathing is very important. Né? The appearance, the nasolabial is very important for the patients. Né? The experience of the surgeon is fundamental the for the life of the children. The goal of palatoplasty is establish favorable conditions for facial growth as well to promote the balance of velopharyngeal function for the development and hearing and the speech. Before surgery, there is no separation between the nasal and oral cavities, as if we were a house without a floor. After surgery, the nasal and oral cavities are separated and allow velopharyngeal function to provide adequate speech production. The main goal of the cleft accompanying the good speech and improvisation of maxillary growth, and the speech disorders are important issue to treatment failures. During speech, velopharyngeal deficiencies, it's possible occur patients when have a large. When the adequate functional, we have a good speeching and good nasality, equilibrated nasality. A pressure is intraoral pressure procedures. Then we have a frequency sound. Then all the patients speak a good production and a velopharyngeal adequate. But we have a difficult, and if it have a dysfunction, velopharyngeal dysfunction, it's possible a hypernasality, nasal air emission, and low pressure. But it's possible a compensatory articulation that interfere the intelligibility of speech. When we need the instrumental velopharyngeal function, you have a nasal endoscopy, and the program use the psychologist and the speech and language pathologist, the psychologist preparing the patient for the exam to diagnose the compensatory articulation, then hypernasality, and the speech disorders. The follow, it's very difficult. It's a fricative, a compensatory production of speech. The auditor perceptual, it's a gold standard to evaluate the disorders of speech. The identification and the characterization of speech disorder related to cleft lip and palate and velopharyngeal disorder is performed by the speech and language pathologist using the auditory perceptual assessment as the main tool. Is through the analyze the speech production, the presence or absent disorders, and is considered the gold standard to evaluate the velopharyngeal the speech. The subject's judgment is very difficult. Then it's necessary standardized protocols and multiple readers to evaluate the speech. Our in Brazil clefting, professionals for various Brazilian states collaborate in the initiative called Brazil Cleft. And one of our objectives to implement and standardize protocol for the evaluation of after primary palatoplasty. Then we need to change our group and calibration hearing identification. The speech change characteristics of cleft lip and palate include hypernasality and use the articular atypical point, compensatory articulation. Then the recording, it's necessary recording speech sample, the video and audio, phrases, repetition, strong consonants and vowels, connected speech, and spontaneous conversation. In our laboratory, we capture the speech sample and create the data bank speech sample. In our laboratory has a acoustic room, and we evaluate the patients and record the same times audio and video, and organize all the plan, the treatment. The patient it's a good speech, a good pharyngeal function, it's okay. But it's very difficult speech, is necessary continue the treatment with a cleft lip and palate speech and language pathologist team. The phrase that you use in the Brazil cleft it's composed of plosive, fricative, liquid, and nasal phonemes. The example is in Portuguese, in Brazilian Portuguese. And another professionals that include our team is the orthodontics. The difference between malocclusion of patients with and without cleft reflex, the anatomy of the maxilla segmented by the cleft, the patient's genetics, and the consequence of primitive plastic surgery, maxillary deficiency. The orthodontics aim monitor facial growth and occlusion development, prepare for alveolar bone grafting when needed, correcting malocclusions, preparing for orthodontic surgery, and follow up from childhood to adulthood. Monitoring facial growth and occlusion development. The child is the same. The photos is the front and the profile. It's in the adolescent and when the adult. The appearance nasolabial, it's okay. The variation, maxillary and mandibular, it's okay. And but sometimes it's necessary prepare the patients for orthodontic surgery. The use attack gauze and gauze-loyatic to evaluate the occlusion. That's the adolescent. We prepare the orthodontics team prepare the patients for orthodontic surgery. This time is orthodontic surgery, and after the treatment, and continue with a speech and language pathology team, because I need to exercise the oral, facial, or myofascial functions. Our conclusions, the CADEF model demonstrated the important coordinated multidisciplinary care in improving the functional and social outcomes for individuals of cleft lip and palate, ultimately promoting social inclusion. In our center, we include the festivals, the carnival, go to the cinema because it's very important for them. And sometimes in other activities, they talking about and wrote that Gaddafi is the second house. Thank you.